Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health and the Wellness Forum Institute for Health Studies. So, first of all, some free stuff. Next week is the free mastery course for health professionals, Tuesday, Wednesday, and Thursday, 8 p.m. to 11 p.m. I'm going to video it, film it, so that if you can't join us live, you can watch it later. We're going to cover all kinds of topics, ranging from clinical skills to marketing yourself to delivering effective presentations. And I'm asking and have asked everybody participating to suggest topics so that I can conform the curriculum to be what you want to talk about. I did this with the free boot camp in March that we offered for consumers, and I think I did a pretty good job of responding to what people really wanted to know about. I'm going to do the same thing here. The healthcare marketplace is changing. Some people are going to thrive and some people are going to get left behind. We want you to thrive. I want you to thrive, whether you're with us or not. I want to help people do better. So feel free to send an email to pampopper@msn.com if you want to sign up. Now, I wish I could do everything for free, but I can't. So I have two paid things coming up that might interest you. One is the Great Skin Cancer Hoax, which will be on June 10th. That's about sunscreen and sun exposure and health risks and cancer screening, skin cancer screening and treatment and alternative treatments and everything around this issue. And then I'm teaching a consumer boot camp on research. It is a short one-night version of the 8-month course that health professionals take. And in the 8-month course is pretty daunting. Our students spend, by the time they get about halfway through the course, they're spending 20 or 30 hours on their homework in between. So if you're not up for all that, but you want to learn some great skills for figuring out what's right and what's not, that boot camp on June 17th might interest you. So any interest in any of the stuff, pampopper@msn.com. All right, so I want to talk about our current healthcare system, and then I want to tell you a little more detail about what I want to do about it. I think I have a vision that might excite you. I think I'll just start by saying our current system's a mess. It's a really expensive mess. There are a whole lot of reasons why, and we have to do something different. There's no fixing this, and I'll give you some examples of why, and a couple of things that you may not know about that make it really hard to fix. So the Affordable Care Act, we call it Obamacare affectionately, was passed in 2010. A big objective, one of the reasons why it was passed, is that insurance was supposed to be available for everyone with subsidies for people who couldn't pay the full premium. Nobody could be turned down regardless of health status, and no one could be charged more due to their health status either. The net effect is that actuarial science was eliminated from health insurance underwriting. So when you think about purchasing automobile insurance, your age, your sex, driving record, citations, and claims that you've made, and the value of your car are taken into consideration to determine the premium you pay. Additionally, you're expected to maintain your car. I mean, oil changes and new tires aren't covered by your policy. So if you want your car to continue to operate, you'll likely take care of it. And if you want your insurance rates to remain low, you'll probably drive carefully. So let's contrast that with what happened with Obamacare. You can't be turned down for insurance regardless of your state of health, and the premium can't be adjusted in consideration of it either. All conditions are required to be covered, including those that were diagnosed prior to applying for coverage. And the premium for a 67-year-old person like me who takes great care of herself and takes no meds is the same as a 67-year-old person who weighs 300 pounds and takes 11 drugs. The incentive to remain healthy in order to purchase affordable health insurance was completely taken away. And the new law mandated that there would be no cap on payments for any illness and no cap on lifetime benefits either. And that's not all. All insurance plans are required to cover preventive care, like annual exams and cancer screening, depression screening, immunizations, alcohol misuse screening, fall prevention screening, even aspirin when prescribed by a doctor. And that's just a partial list. It's a really long list of other services that I, for example, will never use. If I'm purchasing a plan on the exchange, I can't opt out to lower my premium. And the fact that most of the required preventive services are useless and some are harmful doesn't matter either. Medical centers aggressively promote them. Let's face it, it's their dream come true. Full reimbursement, the patients pay nothing, giving the appearance that it's free, and lots of it's included in the plans. My private health insurance plan has a high deductible, $10,000. High deductible policies are great for people like me who take care of themselves and who can afford a large out-of-pocket expense if something catastrophic happens. The 2010 law grandfathered in these plans but prohibited the marketing of new ones to consumers. So healthy people have no option but to purchase overpriced insurance that they won't likely use much of. In 1996, HIPAA legislation dictated that actuarial tables could no longer be used to determine the premiums for group insurance plans. And then in 2010, the Affordable Care Act eliminated them from use in determining individual premiums. The stated reason was equality and access for all, but the real effect was to eliminate any scientific evaluation of risk from pricing insurance plans for health coverage. So just imagine how the auto industry would look if everything, including routine maintenance for your car, was covered. Your age, sex, and driving history couldn't be considered in assessing the price of your premium. And future accidents, regardless of how many you had, how big the claims were, and how expensive they were, couldn't result in rate increase. We'd all have to park our cars and start walking and riding bikes, but that's not how it works, fortunately. Those of us who maintain our cars and drive carefully are rewarded. Cars last longer and they're less expensive to maintain, and auto insurance is cheaper. Another less obvious issue, which is that actuaries are good at identifying causation in addition to assessing risk. Well, they've been completely taken out of the equation. So if you look at how actuaries deal with auto insurance, they know that age affects risks. Younger drivers are more prone to accidents. Sex matters. Women are less likely to have accidents than men. And it's why higher premiums are assessed on electric cars. They're more expensive to repair, and there's a high risk of needing a battery replacement even for newer cars. So equal health insurance for all has created a disaster for all. The healthcare bill has been inflated over $4.5 trillion per year because all the incentives are perverse. Obesity rates have increased from 23% to 45% after the ability to assess and charge for risk was taken away. There's no financial incentive, at least in terms of insurance premiums, to attain and maintain health. And we know that financial considerations are important. So that's just a little piece. You hear me talking every week about the mess of healthcare, whether it's cancer treatments that don't work and drugs that are approved that shouldn't be and all that. So what do you think the chances are that this mess will be reformed or fixed? If you guess zero, you're absolutely right. All attempts to repeal Obamacare have failed. And special interests like drug and vaccine makers and medical institutions and hospitals, they have profited and they continue to profit from it. And they are huge lobbying influences on Congress. So we're stuck with subsidizing and paying for sickness and worsening health. I mean, our tax dollars are going for it and all that. But the question is, what can we do is for individuals? In other words, if you want to opt out of the system, what can you do? Well, the only option is to set up something outside the system. Any program that refers to itself as insurance has to comply with all this crap that I just told you about here. So the only way to do this is medical cost sharing, and that's the option we're going to pursue. All right, so I have mentioned a couple of times, and I'll mention it here again, that in 2014, I sat down with a couple of friends and wrote a business plan for what an independent healthcare system would look like. And I put it away. And the last paragraph of the plan said that we could do this when consumers were fed up enough that they would pay cash, and when health professionals were fed up enough that they would leave the system and set up independent practices. So I didn't look at it for a long time, kept myself busy doing other things, but here we are, right? So the requirements for joining the medical cost sharing system and being a part of this as a consumer is cash pay for everyday health expenses. That's the first thing. So when your son needs to be cleared to play soccer, some type of sports physical, when you need your levothyroxine prescription refilled, if you want to review your lab results or you have a sinus infection and you need treatment, all that stuff has to be cash pay. Because how this bill got so huge and how this got so ridiculous is the idea in people's heads that it's just all free, and there's nothing free. You've heard there's no such thing as a free lunch, and there really is no such thing as free healthcare. So one thing is cash pay. The second thing is membership to Wellness Forum with having successfully completed our foundational courses. Providers have to train with us before joining the network, and then they have to agree to and practice informed decision making. And I've talked about this before. This isn't rationing care. Anybody who wants something can get it, but we just have to make sure that they're informed before they go through with it, right? So I've used the example, if you want a colonoscopy, we'll get one for you, we'll order one for you. But you have to read the evidence for and against before you make that decision, right? Now, this is where it gets really exciting. When we gather, I'm not using if anymore, when we gather large numbers of people, we can conduct our own prospective longitudinal studies on things like alternative cancer treatments and certain supplements and alternative treatments that are and integrated treatments, right? We can use actuaries, real science, to quantify the data and get some answers on what works and what doesn't work. This is what the NIH should be doing, but it's been so busy making viruses in China and covering up its efforts to do that, that they don't engage in activities that actually benefit Americans anymore. But we will do it ourselves. We can start our own journal and offer a real scientific alternative to the garbage health professionals read right now. So let's dream just a little more, a little bit. In partnership with our foundation's MAFA groups, we could even start our own food banks with healthy food for people who can't afford to eat. Our Food Over Medicine groups, we're starting 10 of them in this month of June, will gather people all over the country who are likely to support our clinic system. One thing that I'm asked often is, what about all the people who are on public assistance who can't afford our system for care? And I have an idea about how we can deal with this when we're big enough. I've decided that at a certain point in time, when we've got this all set up, I'm going to ask every provider who joins our network to offer care to 10 people each year who've been means tested and truly need help. I'm sure that we'll have to do more than this, but at least it's a start. But we're going to give back. We're going to gain a lot in terms of better healthcare for ourselves. We're going to have better environments for practitioners to work on, and we're going to give back to the community in several ways, and that's one of them. All this to say, I'm so glad I took this piece out that I wrote many years ago and dusted it off and read it. It's made me more excited about working now than I have been in a real long time. And I think what we can do is, it's easy to just wallow in how awful it is, but I want to demonstrate that we are Americans and we're innovative and we refuse to remain helpless in the face of problems like healthcare and its ridiculous ineptitude and costs. So this is a fixable problem. It's not fixable by next week or next year even, but it's fixable. I intend to drive the fixing of it before I leave the planet. And fortunately, I'm in great health, so I'm going to stick around for a real long time to do it. So once again, I'll remind everybody there's a mess out there to be taken care of, but there are also incredible opportunities in healthcare for people who know what they're doing. And so if you're interested in learning how you as an individual all by yourself, I'm an equal opportunity teacher. I teach everything I know. You can use it on your own or you can use it with us. But if you're interested in learning how you as a provider can fit into a system that looks like this, either on your own or with us, sign up for my free boot camp. I promise it will change your life. It will change your practice by the end of the 3 nights. I like to think that everything we do has that capability. Deliver on everything. That's one of my core philosophies at Wellness Forum. All right, that's enough for now. As usual, pass this on to anybody who you think would enjoy watching it. Make sure to send me an email at pampopper@msn.com if you are interested in knowing more about any of the stuff that I talked about or signing up for the boot camp. And I will be back to you on Thursday with more news.